Thank you, Jennifer. It certainly is an honor to be collaborating with such a valuable organization to the community as Interact for Health with Jim and with Dan. And they have been instrumental in several of the entrepreneurial activities that we have going on in the greater Cincinnati area, one of which I would like to just briefly talk about, which is called Innovate for Health, which is a community-wide initiative to create a health innovation ecosystem in greater Cincinnati. And I'm very pleased to see some of our accelerator companies that are in the audience. So if you would just raise your hand and say hello to everybody. We've got a couple guys back here, and we have Emily Stenson over here. So without access to health data and information in organizations like Interact for Health, innovation is stagnated. And so many of you may not be aware of the incredible ecosystem that is forming here in the greater Cincinnati area with entrepreneurship and innovation, specifically around in the health space. So I've got a flyer up here to tell you a little bit more about Innovate for Health if you're interested, because I only have a few minutes because Dwayne has a lot of great stuff to talk about. And then just in case, so that I don't forget, there are a couple of other pieces of information here that you can pick up related to the Health Data Consortium so that you'll have more information to take with you. So on to the reason that I'm actually here today, which is the honor to introduce a friend and a colleague and a person who is doing great things for the health innovation and health data movement, Dwayne Spradlin. Dwayne is the CEO of the newly created Health Data Consortium, which he's going to tell you a lot more about in just a few minutes. One thing that I love about the interface with Dwayne is that Dwayne is an entrepreneur and an innovator in his own right. He has had many very prestigious positions in corporate America, driving big changes in the data and information movement even prior to getting into the health space. Most recently, he was the CEO of a company called InnoCentive. InnoCentive is really the forerunner in this whole open innovation movement that many of us are quite familiar with if we've had much interface at all with P&G. So it's this idea that it's very challenging to innovate in corporate environments. And so companies that have the wherewithal to look outside their four walls and recognize that innovation can happen outside have now developed processes in order to pull those innovative solutions into their organization in a way that allows them to then assimilate those solutions and create real value. And so Dwayne and his organization, formerly InnoCentive, was a forerunner in making those things happen. So in just a minute, I'm going to ask Dwayne to come up. But before we do that, I'd like to get a better feel for who's in the audience today. So if you are an innovator, raise your hand. Formally or informally, raise your hand. Hi, there we go. Okay. If you are a startup company, raise your hand. If you're an investor, raise your hand. Thank you. Thank you for those of you being here so that we can have the follow-on resources that we need in order to bring these innovations to life. If you're a policymaker, yeah. If you're a data enthusiast, raise your hand. Woohoo! All right, fantastic. So, Dwayne, you're among friends. We're thrilled to have you here in Cincinnati. Thank you for making the trip, and we're really excited to learn more about what you're going to tell us about the Health Data Consortium and how we as a community can tap into these great resources that are being made available to us. So, Dwayne?
Thank you so much for that wonderful introduction. I wish I had recorded it, actually. So I got a iHeart Data button here up front. I'm trying to think to myself, why does this make me feel so good? And I just realized why. You know when you go on a plane and they announce, you're on the plane to Cincinnati, and you feel really good that you're on the right plane? This is how I knew I was at the right place, because I heart data an awful lot. So thank you very much for having me here today and for that wonderful introduction. Firstly, I'd like to make say a couple of thank yous and words of appreciation. So first to Interact for Health and the Foundation for a Healthy Kentucky for their leadership in the area and everything that they do and really putting the event together and giving me the opportunity to be here today. I'd also like to thank Sunny Southern, who you all know well, but she has both been an inspiration to me in DC and the work I'm doing here, but also sort of keeps me connected with the entrepreneurial world, which has been utterly fantastic. I want to thank Jennifer Chabinsky in particular from Interact for Health. She has been an excellent conduit into this event and has made sure that I am prepared and ready for today. So thank you, Jennifer. And I also want to thank Damon Davis and all of the leadership from HHS. HHS has really been a key driver in this open data movement. They've shown tremendous leadership there in Washington. Damon's here today. Damon, where are you? There's Damon's in the back. If you haven't met Damon, you should, but he is an absolute powerhouse in this space. So thank you, everyone. Let's sort of start with some of the basics. You had asked who was in the audience. Who in the audience has ever been a patient? All right, so we've got almost complete participation here. We share this system. So here's the reality. We spend nearly 20% of our GDP on healthcare. And I don't have to tell the people in this room, we ought to be darn near at the top of that list. And the reality is, whether you measure it by mortality or morbidity, we're almost at the bottom of the list of highly industrialized nations. We have to do better in healthcare as a country. And for the amount of money that we spend, we should be covering more people across the system, and they should be getting better health care than they get today. That is the hallmark, I think, of a great nation, and we can do better. We think that information and technology is a good part of the way that we get there from here. It's absolutely critical. And as advanced and sophisticated as we are, I saw the number of hands that went up when Sonny asked how many of you are innovators. Every one of you should have raised your hand. The reality is we all are. We all play a critical role in the evolution of the system. The brutal reality is we don't use the technology and the information and the informatics and all the tools at our disposal. So that is front and center for us. So what the Health Data Consortium and this whole movement is about is putting that health data to work to fundamentally transform the system. We know that there are changes that are being driven by, quite frankly, the need, the crisis we have in the system today, but also by regulation in response to those changes in the system, by laws and by necessity. So we have risk-sharing models now that kind of fundamentally change how dollars flow in the system. That'll have a huge impact. We're implementing reform, the Affordable Care Act, the High-Tech Act, and all the things that come with that. We also have sort of the emergence of a new thinking around using information. So whether that's outcomes-based decision-making or evidence-based decisioning, we have some fundamental transformation happening in the system. But this is all powered by data and information. And that's really why, if we do this right, we can fundamentally change the system. This all requires a data-centered approach. And so as we think about and talk about data and information informatics, whatever sort of set of words you want to apply across that, what we're really talking about is the fundamental transformation of the system and how we manage the system as we know it. And so we think step change is possible here. Not just incremental change to the system, but a powerful transformation of the system here that can be enabled. I am not, truth be known, from the healthcare system. Todd Park, who some of you know very well, he's the U.S. CTO. He was the CTO of HHS up until a few years ago. Actually asked me to take this role on behalf of HHS and the Robert Wood Johnson Foundation and a number of other organizations that got together to really create this public-private partnership that we'll talk about, the Health Data Consortium. But I said, can't you find somebody from healthcare to do this? And he said, it's exactly the reason that we're so interested in you taking the role, Dwayne, is because you're not from healthcare. So much of the change, so many of the questions that need to be asked by people outside of the system. And it's going to be that collaboration between the system and different ways of thinking, sometimes asking those dumb questions that may very well help propel us forward. And so I'm more than willing to ask those dumb questions. Okay, so let me ask you this. I love this notion of what if. Right? What if we could actually answer some of these questions? Which patients require interventions right now to avoid excessive future medical care? Think about that question for a minute. Where do we get the answer to that question? Is it by asking? Or is it in the data? It's in the data. The information is there. And for those of you in the audience that try to get to these kinds of answers every day, you'll find it sort of exceedingly difficult. We know the data is there. In some cases, we can even see it in local populations. But more broadly, we have a very difficult time getting to sort of these kinds of answers that we're looking for that we know are critical to changing the system. What environmental and social factors don't we know about that may very well correlate to more effective disease management? How do we improve medication adherence? What if we could integrate better data and information into key areas in medicine? Decisions at the point of care, patient monitoring, better interventions, clinical trial design, physician hospital selection, all of these things are the kinds of questions we should be asking every day, but we need the information systems. We need access to that knowledge to fundamentally drive these kinds of better question asking and then answering, which will fundamentally change the system. So my first 10 years in sort of the real world was in management consulting. And as I mentioned a few minutes ago, I'm not from the healthcare arena. The reason I mention that is I'm probably from every other industry. And, you know, I think it's almost cliche-ish at this point to compare the healthcare arena to, for example, finance, although it's sort of convenient and easy to do. People say, well, you know, I can walk into, you know, a hotel in Dubai and put my ATM, you know, put my card in the ATM machine and get money out, and the amount of sophistication and technology and policy and political innovation that had to happen to make that truly possible in the real world is mind-boggling. If we could do it there, why can't we do it in healthcare? There's a piece of me that says that's absolutely true, and there's also a piece of me that says this is a really complex system. But the part of my background that really comes from other industries has seen a few things consistently, time and time again. And that is that change is hard, but that in every one of these industries, if we sort of take a cue from how they evolve, they get more information intensive over time, they get more technology savvy, and they get more efficient and effective as a consequence. We've seen that in every single industry. So the other thing that I want to bring to your attention is I don't think it's just words when we say, let's put health data to work. I don't think it's just words when we say, wouldn't it be nice if we could answer these questions? The examples, the archetypes we have to go by of industry change in every other industry has had substantial and profound effects. And so that's exactly what we're trying to mimic here. We think that if we unshackle the data, if we unleash the data, a number of incredible things will be possible, as we just said. But that said, this is a very, very complex space, and the challenges are daunting. And I want to share a few of those here just to sort of put some framing around the day. There is no single organization, I think now, until the Health Data Consortium, again, which I'll introduce you to in a few moments, which really sort of helps represent all the complex entities and stakeholders in the system. Most of the organization, if you're an entrepreneur or in the room here or driving a startup, you've probably already had that sort of struggle with exactly what is this HIPAA and how do I use information and what does it all mean and how do I share and where do I find it and is it quality data and what do I do with it? It is a very, very complex arena to be in. And if you're already in this space, you know many of these issues already well, but it's a complex space. So whether it's the regulations or the use cases or the guidelines, how do you even sort of put this data to work? It's also highly fragmented and awfully poorly described data. So if I can find data, what does it look like? But that assumes that I can find the data. We have data in hospitals, in research institutions, in foundations, in government agencies. And even when we have the data, it's often broken into pieces. It's broken by states, it's broken by counties, and sort of really having a holistic view of that is very, very difficult. It's very fragmented. And I think we also have a pretty poor market understanding today of what are the right questions. So I posed some questions a few moments ago, right? What if we could actually improve medication adherence? But what are the most important questions you'd actually ask if you had access to the ultimate data set? And what I find is that it's extraordinary what happens when you open up people's thinking. If you're doing research in childhood obesity, you've got a whole set of questions you'd love to get answered. You've almost given up on getting those answers today. It's so darn hard. Where is the data? How do I get it? But I am here, I can assure you, I promise you, as we sort of begin to free the data and make it available, the number of those questions that we can help answer and the impact it will have on this health system will be absolutely profound. I mentioned we've got lots of stakeholders. Boy, not being from this system, I had no idea. Oh my gosh. My hat's off to you because you're in the system and you probably understand this much better than I ever will. But let's sort of look at this list for a minute. We have researchers and providers and patients and academia and state and local and venture capital represented in the room and media and journalists and advocacy groups and tech developers. And this is a very diverse system with a lot of stakeholders, all of which have sort of very complex information needs and very often information to share. But sort of really trying to understand how we manage a system like this, looking at it through a data lens, as you can imagine, is pretty daunting. So I wanted to go find out how really complex this thing is. This is as close as I can get. Has anybody seen this chart before? Now, granted, I think it was probably a little bit politicized, But what's really interesting is they sort of tried to chart out all the different parts of the healthcare system, and I was looking for tools to help me understand it. It turns out you could double-click on this chart and really go down to the detail. Right? That's the interesting piece. The reality is this is a very complex system. So as we sort of look for the ways to really begin to orchestrate and harmonize all of our efforts around the health data, we know we've got our work cut out for us. But what we do know is that we can have that sort of profound effect. And improving the health and healthcare of our system is absolutely a national priority. So the triple aim is sort of a powerful tool for a few reasons. It reminds us of the things that are important, and it doesn't let us forget a few of the big ones. In particular here, we do want to improve health. We want to enhance the care experience, and we want to reduce the cost of care. And we want to do all of those at the same time, and it's this belief that those are reconcilable. So I believe we can do all of these as we improve our healthcare system. And I think the Affordable Care Act does something very important. So in all of those other industries that I mentioned, there was almost always something which drove the change. You needed what I call a forcing function. So if you happen to be, for example, in the retail arena in the late 90s and early thousands, then your forcing function was online buying and online websites, right? This was an existential moment for you. You needed to figure out how to sort of adapt to the new world. And without that sort of crisis, you really weren't going to change. And so a crisis is a terrible thing to waste. And so what I think we have is a health system here which has a fundamental crisis. Things like the Affordable Care Act here, which you all know well, and others, do two things. One is it sort of recognizes and focuses all of us on this crisis that we're trying to solve. It says we can have an impact, but it also creates a forcing function on the system. So for many of you in the room who are sort of dealing with the Affordable Care Act and meaningful use and others, you now have a very real, you have a reality in front of you, which is you have to adapt as an organization. Everything from reimbursement to how you do reporting is fundamentally changed. So you now need information in ways that you didn't necessarily need it before. If you're a physician or a researcher, you now sort of see a line of sight potentially to change in the system that will get you access to that data. If you're a startup, you see immense possibility. You see something that represents 1/6 of the U.S. economy and probably the most intriguing opportunity for VCs and startups in the last 100 years. It's 1/6 of the U.S. economy, and the money's flowing in. So all of this represents change and exciting change, and that's why we get so excited about all of this. I just wanted to use this background slide, which I thought was pretty incredible. But I want to talk for a couple of minutes now that I've hopefully set up some of the backdrop and why we get so excited about sort of the birth of the movement. So if you'll allow me, I always wanted to channel Todd Park. So how many of you know Todd Park or kind of his work? Quite a few. So Todd Park is, he's the U.S. CTO, as I mentioned. He was the CTO at HHS previously. But he's really an entrepreneur and a very, very successful entrepreneur. So he's one of the co-founders of a company called Athena Health. He's also one of the founders of Castlight Health. And he was really tapped by, and I think it's one of the smartest sort of people decisions you could make in government, when President Obama tapped Todd Park to become the CTO at HHS and now at the White House. Because what they picked up was they picked up somebody who was incredibly passionate about change, a real entrepreneur at heart, and somebody that sort of fundamentally understood, I think, the power of data. So if there's a real father to the open health data movement in the United States, popularly, it's Todd Park. So we always tip our hat to Todd. But one of the things, and the reason I say channeling Todd Park, is he tells a wonderful story about what was in his mind when this thing was launched. And he talks about something called NOAA. So you probably learned all about NOAA, through one of the recent hurricanes. But NOAA is the National Oceanic and Atmospheric Administration. And so in the 1970s, NOAA started releasing all of the public weather data that they had been tracking from weather stations across the country. And they basically said, let's put it out there and see what happens with that data. And so ultimately, companies and organizations started forming to put that data to work in really interesting ways. So what we know today, for example, as the Weather Channel, really got its data from the National Weather Service, which is part of NOAA, and it really emerged as a business and a business model and design all based upon the availability of data and using it in new and interesting ways. In fact, whether you're using your phone or you're getting a piece of paper at the hotel that says, here's the weather today, these are all businesses that were created based upon the availability of that data that nobody imagined back in 1970. Nobody did. So one of the great insights that I think Todd and his colleagues had was that if we make this data available, we can also launch a revolution in innovation, and that the private sector can do things that we never imagined possible in government. So the other huge, clear driver of all of this is this fundamental belief that a piece of this is really inspiring and igniting an innovation revolution, which we think is entirely the reality here. People told me I probably shouldn't use him, but I got to tell you, this notion that Todd Park kicked off became a movement. And that movement is the open health data movement. And it's all about freeing the data. So you're saying it in your heads, freedom. Well, that's what this is all about. We get the data out there, magic will happen. Companies will form, we'll change the consumer experience in healthcare, we'll improve research, we'll accelerate disease cures, we'll lower costs. All of those things happen as a result. So, the Health Data Consortium. I mentioned that we were founded a couple of years ago. The first CTO is me. Sorry, CEO is me. I started back in February. We're a 501c3. We're a public-private partnership based in D.C. Some of you may know the Health Data Palooza. So the Health Data Palooza event was really started by the U.S. Department of Health and Human Services and became so big and so broad that it is now actually part of Health Data Consortium. So we are now the official conveners of that event. We're an advocacy and a membership organization. We work with foundations, businesses, governments, but also data scientists, entrepreneurs, innovators, and patients. What does that mean? We're working around institutional change and also grassroots change. And you'll see the threads now because we just talked about innovators and founders, and we just talked about the need to have an impact for healthcare organizations, providers, and so forth. So we really want to be the organization convening and connecting all the various parts of the system. What's the elevator pitch? Health data will transform health and the U.S. healthcare system, but it can't happen soon enough. So you'll hear me use the word catalyst. We think we can catalyze this effect. It's vital to liberate the health data, to ignite innovation, and foster collaboration amongst all the players. We'll establish the ecosystem, promote responsible health data use, and hasten the movement. We'll quite simply accelerate the benefits for the entire country. So, how do we think about data? Boy, there's a lot of data out there. What you see here is you see data in the Medicare arena, Medicare and Medicaid, so CMS, vital statistics, clinical trials data, healthcare providers. But you know what? It gets more and more interesting. So how many of you have, for example, a Fitbit? How many of you are sort of watching what's happening with consumer devices throwing off massive streams of data? How does that play into the system? Environmental Protection Agency system. What about behavioral data, system data that's coming from, Facebook and social media? Could all of that sort of play a role as we try to understand what's happening with patients and care and health in the United States? Of course it can. So we think about all of these various kinds of data. But you also have to prioritize. So as we sort of think about working with the different corners of the system today, here's how we've prioritized our efforts. We're working predominantly, first and foremost, I should say, with the federal government and a lot of the federal government data sets. Think of a Pareto chart, right? The biggest, highest value opportunities are on the left. Of course, the lion's share of the value may actually be on under the long tail over time, but you go after the big targets first. So data sets that are being made available right now by the federal government, by Damon Davis and HHS, are all incredible. And so we're working very closely with HHS right now on prioritizing data sets, helping to evangelize their use, ensuring that they are sort of being put to work across the country. But we're also beginning now to work with commercial health organizations, state and local organizations around their data. What data do they need? What data can they provide to the system? And then we're making our way through research, and ultimately we'll also be working with what I call the commercial non-health data set. So those are things like behavioral data and others that we can put to work. But we're sort of starting with the big data sets first, and that's largely validated by the kinds of questions and requests we get, for example, from state government saying, can you help us work on alternate forms of claims data, or researchers saying, can you help us sort of work with the NIH and others to get access to data that will help us in our research programs or to understand how to better inform local health policy. The Health Data Consortium has a focus in 4 areas today. The first is we want to inspire. We want people to be excited about health data. What can we do with it? Whether you're an entrepreneur or a health decision maker or a policy maker. We want to connect the various groups. So doing events like these give us a unique opportunity to really connect with the different parts of the ecosystem, but to understand what they need, what they can do. And I would say that also sort of lights up the world of the possible. So at every one of these, so Sunny took me all around town yesterday, and I had it was just really a unique opportunity to meet all kinds of groups from, the entrepreneurs to the United Way. And it was an exciting opportunity to sort of get a sense of what all of the action that's happening here in Cincinnati, but also to get a picture of where those opportunities are, where the needs are, how we could possibly collaborate with the different groups. And so we see that all over the country, which helps inform what we're doing, how we're investing our resources. The next are accelerators. How can we sort of create tools to make this easier for the different parts of the organization, whether they're education-based tools or, sort of online tools to help connect, users and providers of data, and then also what we call enablement. So for those of you that are right in the midst and the flow of this activity, you run into things like, what are the policies around patient privacy and data usage? How would I license data from a commercial data provider and sort of do it in a way that's scalable? If I'm a research institution, what are the sort of the data usage guidelines that typically apply to me? How do I sort of make that work? And as we mentioned earlier, if you're an entrepreneur, that's a pretty daunting undertaking. So if we can create sort of efforts around enablement to sort of really make this easy, what I call taking the friction out of the system, then we actually think we'll see significant impact. So I wanted to share with you a couple of the initiatives that are already underway. The first one is what we call the Health Data Bill of Rights. And so every good Bill of Rights has 10 things on it, right? So I'm only showing you up to 4.5 because I want to tease you, I want to get you interested, but if you go to the website, you can see all 10. And this is still a work in process, but we've been working with all the different corners of the system to sort of really understand what would kind of a social contract look like around health data. We know that individuals, right, if you ask them, do you want anybody seeing your health data? Like, are you concerned with your health data? You know what percentage say, yes, I am? 100%. If you talk to them and you ask them, if you knew what your data was going to be used for, and people wanted to use it for research purposes, would you allow your data to be used? And the number is 87% would allow their data to be used, right? So it's sort of this balance and informed consent. There's a lot of issues here, but the patient is fundamentally a stakeholder in the system that has a role to play and rights to protect at the same time, but could fundamentally be, a very, very powerful participant in the system. Companies, we too often sort of separate the private sector and the public sector. And we say the private sector only acts out of self-interest, and we say the public sector, never acts out of self-interest, I guess. But I think the reality is that this is going to take a collaboration of stakeholders. The consortium and Health Data Consortium doesn't care whether you're for-profit, non-profit, or government. What it cares about is what is it going to take to put the health data to work. So when we say things like open health data, open doesn't necessarily mean free to us. In fact, we see so much of the innovation coming from the private sector and innovators where there's real, sort of profit potential. We take a very enlightened view and say if we can find ways to enable the flow of data and certain corners of the ecosystem can find sort of effective and responsible ways to monetize that, so be it. That's going to help power and fund innovation in the system. So can we find ways for the different parts of the operation to work together? And traditionally, they don't work that well together. So we're going to find ways to do that. And what I'm finding over the last several months, meeting particularly with the for-profit side of the world, is there is an enlightened self-interest and a social good at the heart of a lot of these organizations. They want to find ways to make it work. So as we sort of tackle things like privacy and sharing of data, they're going to be very, very powerful participants in the system. But also then the role of foundation and government and others. So all of these can sort of find a new balance, sort of a bill of rights to say, here's how we think about data and all of the participants, and if you will, almost a new social contract around this. My view is we all own the data. We have to manage it responsibly on behalf of the patient, but public health can fundamentally improve and change as a consequence of that. So something like a Bill of Rights here helps sort of establish that sort of new dialogue. We have something we call the Health Data All-Stars. This is really meant to augment some of the phenomenal efforts already going on at the federal government level, like healthdata.gov. So what we've done is we worked with the California Healthcare Foundation to create what we think are 50 amazing top-flight data sources from around the country to really to do two things. One is to get these data sources in front of the people that need them, and two, to sort of highlight the real power of what's possible here. These are amazing data sets, almost every one of which I would say probably none of the people in the room even knew existed. So we're really trying to highlight the power of the data, and these are incredible. If you get a chance to go to the Health Data All-Stars on the Health Data Consortium website, you're going to find that this is an amazing resource. We're now plowing more resources into finding the next 50 and the next 50, and ultimately this will evolve into what we want to think of as an atlas that will sort of connect the providers and the consumers of health data across the system with the tools that they need to get to all of these alternate and amazing sources of data. And we're going to build community around that. I want to share one more. So this is a program that right now is in the feasibility stage study, funded by the Robert Wood Johnson Foundation. And so we've taken a page from the playbook that you see in corporate social responsibility and the green movement, right? All of those movements tried to do something pretty interesting. Take a space that's sort of hard to change on its own and create a very constructive set of tools that would sort of help hasten the change. So what we're doing is we're running feasibility studies right now. We're interviewing almost 50 stakeholders from across the system to say, what would an open health data practices scorecard look like? And what if we could sort of take states, for example, and say, you know, you're number 5 on the list, you're number 40 on the list. What could you learn from number 5 on the list? What are the lessons? What are the best practices? What works and doesn't work? And let's take that one step even further. What if we could essentially use that to create the best practices in the playbooks that states or counties or cities or insurance companies could apply to essentially apply these practices so that they're not starting from scratch? It's really sort of a broad learning community. And so that program will be done in January, and we'll make a decision at that point whether to move on. But if we do, then what we'll do is we'll create a set of certification programs and scorecards, which we think will actually be very, very powerful in this space. The Health Data Consortium has a pretty impressive scorecard of founders and supporters today, and this list is getting bigger every day. This is a sampling. But our heritage includes groups like HHS and the Institute of Medicine and the Robert Wood Johnson Foundation, but we also have impressive commercial entities now backing us as well, like GE and Sanofi and Merck and Athena Health and others. So we're very, very excited about where we are. We've got a lot of work to do in front of us. I wanted to now switch gears a little bit just because I know the topics for the day and share a couple of thoughts around what's happening, I think, more broadly. This is really all part of what I think is a digitalization of medicine. And so I wanted to kind of share a couple of thoughts that I have there. I think we're all evolving digitally. And the thing I love about this chart is I think the guy at the end there is actually working on a PDA. But what we have is just a fundamental change in the way we sort of all interact with the environment. And it's all technology and information driven. Really, it's sort of an historic time, I think. You know, we're all familiar with Moore's Law and what it's sort of meant to electronics and the technology arena. But fundamentally, everything's changing to online, mobile, social, and cloud. And that's going to have profound impacts on this space. What I call Business 3.0, which is a change of the way that we think about the organization of businesses and institutions to really being sort of globally focused and engaged with the customer in ways that are sort of intimate and never possible before. And this is a broad knowledge economy. The 1970s and 80s may have been around data warehousing. Now it's about actually putting information to work to fundamentally change how we manage these systems. The consumerization is an incredibly powerful term here. I can't underscore enough. The role of the patient in the system today is not at the center, and it hasn't ever been, I think, in the healthcare arena. And I don't mean that to step on anybody's toes. What I mean to say is this is a system that's been about delivering care, but the patient's not been at the center of that care. And so I think one of the things, again, that we've seen in every other industry, and I'd mentioned there's sort of almost a playbook. Every industry changes in a pretty similar way, actually, is first you see the role of technology break the system and remake it. But then the thing that we have seen in every one of these industries is a shift to the consumer at the center, right? So when we talk about, there's phenomenal things happening right now in electronic health records and others. But mark my words, in 5 to 10 years, the patient will be at the center. The patient will delegate their information. The patient will have access to information, and they'll be able to make choices about what they do and how they do in a way that they've never been empowered to do before. And so this consumerization is happening here just like it has in darn near every other industry. Health IT, health records. I'm going to talk for a couple of minutes about the next two in the next couple of slides. So this is a really interesting space, but my gosh, has the acceleration of innovation really kind of captured not just the imagination, but it's fundamentally shaken all of this to its core. So I pulled some of my favorite sort of magazine article covers out for this. And so you've all probably seen what's happening with, distance-based medicine and robotics. Fundamentally kind of changing how you can deploy medicine and how we can automate it. Have you been following 3D printing and sort of everything from printing of tissue to, I just read an article that they've now got the ability, they're testing it, to take let's say that you've had a piece of your skull removed, they can 3D print, essentially the augmentations for that based upon essentially, an MRI cast of the skull, and it's a perfect fit. I mean, we're doing things with 3D printing now. Who would have thought about that a few years ago? And of course, I heart data. But down in the lower left down there, you just see fundamental changes in the way that we're using technology, and you see sort of this role of connections and social interaction. And we're going to talk a little bit more about that. But innovation fundamentally changes everything. I'm going to argue that once we take into account mobile and technology and information sharing and the internet and all of the rest of it, and all of the sensor technology that's now emerging, whether it's the Fitbit in your pocket or what you're soon going to find that your cell phone can take air samples and real-time telemetry on your environment. We can sort of see that at a national level and inform people around when they're in safe areas and when they're not, and what's happening environmentally and everything else. What we're going to find, by the way, how long until you can do that? What we're going to find is that all of these things are data and information. And in fact, I'll sort of challenge you here in a few moments. I'm not sure that Fitbit, so you all know Fitbit, right? We said Fitbit. By the way, if you look at things like Fitbit, it's changed the conversation entirely. My oldest son goes to college, he's got a Fitbit, and I get taunted by him when he sees that I'm not walking enough every day. Think about what that means in a clinical setting, but for patients, right? Think about what it means to actually have that kind of relationship with patients enabled by the technology. Patients like me, so communities of information sharing. I saw an interesting statistic. There are more papers published, more papers where patient like me data is cited than virtually any other source. And one of the latest numbers shows something like 2,000 peer-reviewed papers based on patients like me data. That is staggering. Do you know the company called Proteus? Has anybody heard of Proteus? So imagine a smart pill that actually has essentially a biodegradable RFID type apparatus inside it, and it can tell you when it's been taken. And by the way, when it goes into your body, it'll sort of wire back, if you will, telemetry about what's happening in the human body. So I can take real-time tracking of this. And of course, the FDA had to clear it, but imagine the implications. Do you know Gluco? Do you know the company Gluco? So this is one of many companies that are essentially allowing you to take your readings for kind of, your insulin readings. I'm going to check my blood chemistry for insulin and sort of wire it into a system that can take that right back to your doctor so your doctor can see your readings in real time. But if those things are off the chart, could actually drive an intervention so that you get a call to say something's wrong and we need to intervene right now. So that kind of interaction is really pretty phenomenal. And sort of producing the reports that people can actually action. iTriage, I think this is very, very well storied. I actually saw a video from someone whose life, he's alive today, and he sort of explains why, because he had basically a heart attack, and he had his iTriage app, and by pushing a button, it called emergency services right there to come help him, and was giving the information he needed while he waited, fundamentally changing the patient experience. 23andMe, is anybody here on 23andMe? Do you know what 23andMe is? Personal genomics, right? So all the data thrown off by looking at you as an individual that can sort of help inform your health experience. It's more about just who you are. 23andMe actually tells me whether I'm going to have whether genetically I'm likely to be more or less disposed to a drug interaction, or whether I'm more or less likely, to be a candidate for a particular kind of a class of diseases. So it's absolutely fascinating. I'm on 23andMe. Of course, my kids thought the most interesting thing is I'm 3.1% Neanderthal. Asmopolis is going to be talked about, I think, later today. It's just a phenomenal other example of this. But what I really wanted to do was kind of share all the things going on around the data to kind of give some context. So we can talk about freeing the data, right? We can talk about all the opportunities there. But this stuff's happening in real time. You couldn't avoid this if you wanted to, right? So how do we sort of mold it and shape it and kind of create a future around a data-driven future that fundamentally changes the system? Here's my challenge. Here's sort of a thought problem. Is your Fitbit a consumer device that throws off data, or is it a data acquisition device for what's really an information company? I think every one of these are information-based companies, and we're going to all put that to work in healthcare. So these are all data companies. So data is now front and center. We talked about all of the reasons why, but we still have a lot more to think through. So in my last couple of minutes, I just wanted to share a couple of more thoughts with you. I think that as many amazing and powerful things as we can do, that doesn't mean that this is without consequence, and it doesn't mean that there aren't very serious and weighty issues that we have to think through. So I wanted to share 3 that are sort of very top of mind for me in these kinds of conferences I usually share with the group. The first is, we have an ability now to maybe think about things like health disparities and really understanding where the gaps in the system are and where we can provide help. But that also means that we've got a more vivid picture than ever of, for example, rural communities that may have very different opportunities to treat patients as urban communities, or where we've got gender or race or other factors which are fundamentally represent disparities in the system. And we talk about how the digital age can help us erase those disparities. But I'm not sure we've thought enough about that. Do we actually create sort of a digital divide if we're not careful, where the best kinds of treatment are happening for people that actually have access to the internet and high-speed digital access and all the rest of it? So we need to make sure that as we do this, we're actually bringing the benefits of all of the data and the technology to 100% of the population. And I don't think that happens unless we sort of think about that sort of thing every single day. The second is patient and patient privacy. So as I mentioned earlier when I talked about the Bill of Rights, it's fundamental that we sort of recognize the right of patients to protect their information and privacy. But it's not as easy as it sounds, and it comes with some costs. So as many of you in this room will know, we have very powerful safeguards in place like HIPAA. And we try to apply very powerful statistical and mathematical models to de-identify the data so that it can be used for various kinds of uses. And we've gotten pretty good at that, but not good enough. So how do we protect patient data but ensure that we get 100% of the data into the analysis systems that are needed? And how do we really sort of give absolute assurance to a patient that if they don't want their data shared, nobody will ever sort of reverse engineer who that patient was? An example of this is if you're all familiar with Netflix. Netflix did a challenge a couple of years ago that was fascinating. They wanted people to improve their recommendation algorithm to tell you what movie you should go buy. So they de-identified a ton of consumer data. And it was, statistically, it should have been impossible to figure out the identity of any one person. And some brilliant data scientists backing into it, and they were looking at what movies somebody rented and certain facts about who they were, and they eventually got down to a zip code and a block, and they actually identified precisely who that person was and what movies they had been renting. And it was, sort of catastrophic for that person because that was very personal information for them. So we take these things very seriously. But we have to figure out the right way to do this. We all know medicine's better the more data we have. And we all know that the rights of the individual to their information privacy, should that be what they want, is paramount. So how do we reconcile those? And those things are top of mind and have to be in every conversation. And I mentioned the digital divide earlier, which is how do we actually ensure that we get care and that we use these tools in sort of responsible ways. So with that, I want to say I think this is an extraordinarily exciting time. One of my favorite authors when I was a kid was Kurt Vonnegut. And so if you're ever Kurt Vonnegut, he's sort of an eccentric guy. Actually, he's from nearby. I think he might have gone to Indiana University. But he's got a great quote, which is, "I want to stand as close to the edge as I can without going over." Out on the edge, you see all kinds of things that you can't see from the center. I think we're at a very, very extraordinary time. I think we don't know necessarily what the future looks like, but it'll be technology-driven, it'll be data-driven, and it'll be amazing. But we're all right there at that edge. We're sort of peering over, looking at the things that are possible, and the decisions we make right now around things like the availability of data, but also patient privacy, will fundamentally shape this. So I think it's an extraordinary time. I'm incredibly excited. I want to say that the agenda for the day looks outstanding. And I am just as thrilled as I could be to have had the opportunity to address you today. But I want to thank you for hearting data as much as I do. I want to thank you for everything you're doing, and a particular sort of hats off to the innovators in the audience. I know that you're going to be the ones that sort of help us realize the real potential of all of this. Thank you. Take a couple questions. We could probably take a question or two if anyone has a question.
Hi, can everybody hear me? Okay. Thank you for that presentation. Very exciting stuff. I think I heard you mention that in this movement, you kind of stated that you need people from outside the healthcare arena looking in with a clear lens. Well, I think you need both sides. I think you need people from outside and from within the healthcare arena. I'm a registered nurse, and I'm also a data manager, and I'm also working on my master's in nursing informatics. And I can see a million ways I can help with this type of movement. If you're looking at patient care, I think nursing is paramount if you want to touch the patients and get them involved in certain things like the technological devices that you mentioned. Who's going to teach the patients how to use that? Who's going to teach the patients about the different websites and the different apps? It's going to be the nurses. The nurses are the ones who touch the patients the most, who are nearest to patients, who teach them about their health, who teach them how to take their medications, when to take their medications, the side effects, and things of that nature. So I think if you really want to be successful, you may want to get a nurse on your team, a nurse or two on your team. So that's pretty much what I wanted to say, and I challenge you to find some nurses, particularly those interested in graduate studies, because those are going to be the ones who you're going to want on your team.
Well, thank you for the comment. So if I didn't say it takes both, I meant to. But it does take both. But what happens is systems try to change themselves from the inside, and you need a few sort of agent provocateurs with different perspectives very often to catalyze that. So it really does take both. I don't think this is a system of, this system is never going to be sort of self-serve, right? I mean, you know, it's about the patient, interaction with the patient. What I really hope is that the technology and the data help us allocate resources and get them to where they need to be and really provide the tools. And in fact, there's a very progressive train of thought that when we use the word consumer here, the word consumer should mean the patient and the people delivering care directly to the patient. And if we think about sort of the development of apps and the use of the data and the analysis, what we're really trying to do is enable the consumer. It's that group which is where the action is. That's where we improve health. By the way, Sunny helps represent the nursing community in a big way every single day. Trust me. But we'd love to have more people involved in this. And you're absolutely right. So thank you for the comments.
Good morning. Statistically, I should be dead several times over. I've just been very fortunate. One of the concerns I have about the future of data evaluation is that we may be making decisions for the elderly that say, we won't make the additional effort in this case because this person's statistically unlikely to succeed. The hospice track, if you will, rather than the maintenance track. And I wonder if you could speak to the humanistic side of that. How should we make that decision when the person or their family insists that there be hope and therefore measures on that hope, even though statistically the data suggests they won't survive?
Well, statistically, I'm not going to address the hospice question, but I will say that. So I'm on the board of a breast cancer research organization, and the reason I was so excited about joining that board is its unique focus is almost 100% emphasis on the role of personalized medicine and forward genomics. And so this is an area where we just see reams of data being thrown off. And the way that I think about that is that what I call an N of 300 million and an N of 1. Right? When we look at big data, the promise of big data isn't that every one of us looks like an average or a median at the end of the day. It's that with over larger and larger populations, I can see trends that nobody's seen before. And maybe over a broad enough population, I can see that, if I can actually sort of monitor dietary intakes, we spent a lot of time talking about, diet and nutrition yesterday. If I can monitor that, maybe I can actually find a link to something which provides some preventative benefit that I would never have seen in small study populations. So the idea behind 300 million, an N of 300 million, is it enables an N of 1. And so in breast cancer research here, what's becoming increasingly clear is if I can get a profile of that individual patient, whether it's looking at the genomics or the proteomics or any of that, and I can understand them as an absolute individual down to the the genetic level, I can be very precise in my application of treatments and my sort of course of care. So I think the N of 300 million enables the N of 1. I think we're in this sort of uncomfortable middle ground today, right? I mean, I don't think, because we don't have, a large enough N, so to speak, we tend to apply standardized protocols to patients that quite frankly fit into buckets. So one of the things I'm most excited about here is that this big data movement may actually be the final most important enabler of N of 1, of personalized care. And that's one of the things that I am most excited about here. Thank you. Other questions? Yes.
I work a lot with people who have difficulty showing up in the economy, let alone but they show up in health data systems. Usually they show up with incredible amounts of incredibly private data. They have mental health problems, they have addiction histories, they have, various infectious diseases. Are we going to enable all these? Realistically, are these populations going to ever subscribe to health nag apps, saying do better, do better, do better?
Well, so first of all, let me just say again, I think individuals have the right to allow their data to be used or not. I think at a highly summarized level, some of that gets shared across the country, of course, but at an individual level, there are all kinds of reasons why individuals may or may not want their data to be shared. And so with sort of the assumption that we make all of the right decisions around how we manage that process, then how does that sort of enable sort of unique and targeted care for them? I would say that I'd agree with you if I'm not already seeing counterexamples. So a phenomenal application developed around STDs, sexually transmitted diseases. And this particular application works with social workers and local providers, and when it becomes apparent that and typically these are pretty vulnerable populations in inner cities, and when it becomes apparent that this patient, when they find these kinds of patients, when they find the patient, they're enrolled into an application that can be used on their not smartphone, because we know most people have some kind of phone, and they're enrolled. But what it does is it anonymizes them. It allows them to sort of identify where they might have had or had partners. It depersonalizes the process of notifying them. They sort of get a message to log in or call an 800 number, and it's handled very delicately. But what they're already finding in that setting was when they basically said, you need to go notify your partners, it was not happening at all. With a little bit of help and sort of an automated follow-up mechanism and enough trust in the system, because this is being administered by local caregivers and social workers, the impact and the number, particularly of partners now notifying and coming in to be checked, has sort of gone through the roof. So I'm heartened that there are combinations of the data and the technology in responsible settings that will reach into sort of the folks we don't typically have an ability to get to today. But I don't have 100 examples of those. I have a few. So I think it's a challenge. We need to find ways to make this all work. But I am confident that we'll do better than we do today. And I think as we get the models right and sort of the social paradigms right, I think we're going to find engagement levels that we could never have done before. So I remain very optimistic. Great question. Okay, I guess that's it for me. So thank you again. Data liberation, I heart data. Thank you very much. Have a great conference.